Welcome to the Arazy Group's regulatory update. In today's update, we are going to give you a regulatory wrap-up in Singapore that will include the following information: product registration using the ASEAN CSDT, IVDs, risk classification, and manufacturers, importers, and wholesalers licensing. In July 2023, the 9th revision of the Guidance on MD Product Registration was published. In this guidance, Annex 5 and 7 related to the summary of submission requirements for classes B, C, and D were added. As proof of QMS, the MD-SAP certificate, and for clinical evidence of IVD undergoing complete evaluation, clinical evaluation conducted by accredited clinical laboratories may be required. In addition, the templates for Annex 1, Letter of Authorization, Annex 2, Marketing History Declaration, and Annex 3, Safety Declaration was all updated. The second topic is related to product registration using the ASEAN CSDT. 4 documents were updated and published in July 2023. The first 2 guidances are GN17R2 and GN18R2 on the preparation of a product registration submission for general MDs and IVDs. Here, the definition of MD-SAP was added, and the MD-SAP certificate was added as proof of QMS in the CSDT. The third and fourth guidance are e-submission guides for general medical devices and IVD for ASEAN CSDT and IMDRF, table of contents-based submissions in medics. These 2 guidances clarified that for refurbished devices, the refurbishment process must be covered within the scope of the QMS certificate of the manufacturer. And for sites without ISO 13485 or MD-SAP, comparable audit reports for the actual site can be submitted. If you want to manage your product registration in Singapore, consider Regislate, our global registration management software for fast and effective market access processes. The third point focuses on the updates included in Revision 3 of the Guidance on the Risk Classification of IVDs, updated on July 24, 2023. In this guidance, the definition of software as a medical device was added. Also, some factors influencing device classification were added, as well as the modifications to Rules Number 1, 2, 3, 4, and 5 for the classification of IVDs. Moreover, the guidance on the licensing of manufacturers, importers, and wholesalers of medical devices was published with a new revision. This guidance added the definition of MD-SAP. In addition, it added a note stating that the refurbishing of MDs and reprocessing of single-use devices are considered manufacturing activities, and that any facility involved in these activities will require a manufacturing license and be subjected to the duties and obligations of a manufacturer of an MD under the Act and regulations. It also added that a secondary assembly is a manufacturing activity and that the manufacturer license is not required if the company is able to comply with the requirements of the SS 620, Singapore Standard for Good Distribution Practice for MDs. Requirements, GDP-MDS, including the clauses related to secondary assembly or ISO 13485. It added a list of supporting documents required to obtain a manufacturer, importer, or wholesaler's license. It added that for the manufacturer's license, a change in the QMS, ISO, or MD-SAP may also require a change notification submission to registered products manufactured under the same QMS certificate in the facility. It added that for the inclusion of medical devices that require cold chain management to existing devices handled by a licensee, the licensee's QMS, ISO, or MD-SAP has to be updated to include this activity. And lastly, the following annexes were updated as of July 2023. 1. GN02R5. Annex 1, Declaration for Exemption from GDP-MDS. 2. GN02R5. Annex 5, Declaration of Conformity to a QMS, and 3, GN02R5 Annex 6, Declaration of Non-Dealing of Class A Medical Devices. That's it for our update today. If you have any comments or questions, please do not hesitate to email or call us. Check the contact page on our website for an office near you. Follow Arazy Group on LinkedIn to view other countries' regulatory updates and the latest advancements in regulatory affairs technology. Stay safe and keep well.